Good morning. It's a great, beautiful Friday morning with gray sky, raining outside. So I think it's a great way to keep you inside. So I welcome you again on the second day for Early Age Onset Colorectal Cancer Symposium. It's our pleasure to be the host for this year as Northwell Cancer Institute. Yesterday, we have many, many amazing, outstanding patient survivors who gave their part of story and really inspired us to strengthen our efforts towards the screening, towards understanding the disease, and also understanding the needs of patients when they're dealing with this disease. One lesson was learned yesterday that we, being physicians, are so focused on the disease, and sometimes we forget about the patient. And I think this meeting yesterday, I have to admit this part, the best lesson I learned yesterday, that don't forget about the quality of life. And quality of life is not only for terminal ill patients, but quality of life means a lot for patients who will be surviving and living longer. Very important parts of life, eating, living, sexual activity, fertility, parenthood. These are very important aspects of life that sometimes we are taken away by the strength of tumor, and we're trying to treat the patient with an extensive chemotherapy or radiotherapy or surgical therapy, and just presume that part is not very important. So I definitely want to make sure that I took that take-home message yesterday, and I really thank my patient advocates to remind us and show us the mirror, the part we have been missing, being just taken by our passion of treating them and not realizing that we need to really take care of those parts. Today is going to be another exciting day. Every day is a new life, as I always believe, being an oncologist, particularly dealing with GI cancer for the last 18 years, and pancreatic cancer being my first baby, that every day is a new day. So today is a new day. Yesterday we learned a lot, and today our plan is not to talk about those issues, but also try to figure out that how we're going to carve out our future. We do understand that yesterday everybody was in the speed of New York. We have many speakers given 10 minutes and proved that if they can give a lecture of 30 minutes in 10 minutes, few people passed, I failed. And honest to God, I promised Cindy Brassie that, Cindy, don't worry about me, I speak fast and I will be done. But I think when you come to the podium, honest to God, I lose control. And that's what the problem is that. So I'm really sorry for that, but I was told that today's speakers are going to be amazing. They really honor their words of at least being on time. So hopefully we'll be done today in a timely fashion, so you can enjoy the great Friday outside today. I think the second part, I want to also remind you that I really thank you for taking time from wherever you are coming from. The key element is that cancer is a global problem. Cancer not only affects patients that we know about, cancer affects physicians, families, everybody. As we all know that colorectal cancer is the third most common cancer among men and women. And at least we can say in the Trump era that this is the only tumor which is not bipartisan. It affects men and women equally. So I think it's very important for us to not only understand that we can treat this cancer, but screening is the gold standard we should not forget. And the key message again, that 45 is the new 50. Somebody said it very well yesterday, and now I have it tattooed into my brain. So 45 is the new 50, and we also learned that if somebody has a family member with a history of colon cancer at whatever age, -10 is the time to start. But again, that's not the gold standard. If somebody has symptoms, you will not wait for that time frame, and you will move on. Hemorrhoids are common, but hemorrhoids are the not only cause of rectal bleeding in most of the patients. So without any further delay, I would like to bring my next guest, who will give us some home-keeping advices. It's very important to listen to her more than me, because keep in mind, without listening to ladies, you cannot survive. Thank you very much.